Hi, I'm Kirsten Ross, and I'm a pediatric orthopedic surgeon at Central Texas Pediatric Orthopedics.
And my name is Caitlin Lee. I'm one of the physical therapists here at CTPO.
Today, we're going to be talking about spondylolysis and spondylolisthesis. This condition commonly presents in athletes, especially athletes that do repetitive hyperextension and rotation movements. It most commonly presents with back pain. This condition is usually diagnosed on an X-ray and with a clinical examination. On X-ray, we can sometimes see a small crack in the bottom part of the bone of the spine, but sometimes we don't see anything on X-ray and it has to be diagnosed on MRI. On a clinical exam, we are looking for pain with hyperextension of the lumbar spine, as well as tightness in the hips and the hamstrings. The difference in the two conditions is that spondylolysis is a stress fracture in the back part of one of the spine bones, and the spondylolisthesis is actually when one of the vertebral bodies, because of that stress fracture, slips forward a little bit on the vertebral body below it.
The intention with treatment and physical therapy for spondylolysis or spondylolisthesis is first to help restore their movement patterns. We do this by improving mobility globally, not just at the spine, as well as restoring and improving strength, and then optimizing global movement patterns. Typically, this can be broken up into 3 different phases, though this does definitely depend on a lot of different factors that each individual presents with. The first phase might be more protective in nature, meaning we're more so performing exercises that helps to stabilize the spine, as well as strengthen elsewhere. The second phase is more restorative in nature, where we're trying to restore the movements that which are more limited in nature. And then lastly, the return to sport. We want to get you back to your full level of function in a safe way, and we do that through all the exercises in physical therapy. Very commonly, these patients present with this back pain that comes on gradually in nature. So I always like to ask the question, why? Why did this start in the first place? So through my very thorough assessment, the intention is to find the potential cause as to why we might have this excessive repeated force going through this one particular segment of the spine. So I'm going to look at segments above and below the agitated area. I might not only look at just the spine itself, I'm also going to look at the hips. I'm also going to look at how the shoulders are moving itself too. I want to make sure that I safely get your child back into sports fully without compensation to help reduce the risk of their back pain returning, as well as reduce the risk of other future injuries. The time frame in physical therapy with this condition can vary on a lot of different factors. Typically though, I'm seeing patients anywhere from 2 months upwards to even 6 months at a time.
In very rare instances, if patients don't get better with physical therapy, which again is very uncommon, we can do small surgical procedures that can either repair the pars defect or spondylolysis or do a 1-level spinal fusion that would stop the movement and then stop the pain.
If you find that your child is still having pain after a couple weeks of continuing with their activities and their sports, and it's not reducing with maybe modifications to activity levels or hours of practice, so to speak, then that would be a good time to come in and get further assessed. If you have any questions about your child's back pain, please give us a call, as we'd love to help.